How does European tax revenue impact public health care and education for Americans? European tax revenue plays a key role in funding the public services that many Americans might take for granted. When you live or retire in Europe, understanding how these taxes support healthcare and education can really help you plan your lifestyle. Unlike the United States, where healthcare and education often depend on private spending, most European countries fund these services mainly through taxes collected from residents and workers. These taxes include income taxes and social contributions, which vary from country to country but are generally higher in Western Europe. The money collected is used to run government-managed healthcare systems that cover most medical costs. This means that residents can see a doctor or go to the hospital without worrying about high bills at the time of service. Governments negotiate prices for medicines, hospital stays, and doctor salaries to keep costs manageable and ensure the system stays sustainable. These systems provide comprehensive care from birth to old age, with strict cost controls funded by tax income. When it comes to education, taxes support free or low-cost schooling at all levels, from early childhood programs to university. Public funding also helps families with financial support, like child allowances, tax breaks for families with children, and special programs for students with extra needs. This broad funding reduces the financial barriers that might prevent some residents from accessing quality education. For Americans living or retiring in Europe, this means that although they might pay higher taxes, they gain access to high-quality healthcare and education services that can cut down on personal expenses. It's important to research the specific tax rates and social contributions in the country you're considering. Countries with higher taxes tend to offer more extensive public benefits, while those with lower taxes might have more private options. Understanding the local tax system helps you know what your obligations will be and how much you can benefit from these public services. Healthcare systems in Europe can differ. Some are funded through general taxation, known as Beveridge systems, while others are based on social insurance contributions, called Bismarck systems. These differences influence how you access services and how they are paid for. Paying taxes in Europe often grants you access to these services, which can significantly reduce your out-of-pocket expenses for medical care and schooling. Additionally, tax-funded social benefits can support your family's healthcare needs and children's education. In summary, the taxes you pay in Europe directly support the public healthcare and education systems you're relying on. These taxes help ensure that high-quality, affordable services are available to you and your family, making understanding local tax rules a vital part of living or retiring comfortably in Europe.